Well, let's go ahead and get started. There are plenty of seats on the front row. Nobody will take these. I don't know why. I hope you're getting logged in. Please see on, certainly you have it on your chair, and you can see on the screen. We're trying to use a new interactive technology today to allow you not only to be able to answer questions, but also to respond to some surveys. We also have the ability for people to be logged in online, and so we're looking forward to them participating. They, too, can also ask questions, so we hope that they're submitting those questions. And then as we do the polling, I'll get the results up here in the front and share those with you. So I look forward to some great participation. Are we getting good success of getting people logged in? I'm purposely talking a little longer to give you time to do that, so I'm trying to stretch that out. Because my next slide is actually a test question, so making sure that you're logged in and ready to go. I also want to introduce, we're very pleased to have with us today our Dean of the Medical School, Dean Lloyd Miner, who is with us and will be part of the presentation as well. And I appreciate him doing this in tandem with me. Okay, I've stalled enough. You're ready? Okay, first question. Well, I have to say, more Q&A, interactive polling, you have that. Now, the first question, trivia. What is the location of Club Med? In the Caribbean, in the attic, or in the basement? Okay, I'm going to give you a few minutes just to get that answered. Okay, has everybody got their answers in? You're thinking fondly of the Caribbean or fondly of the basement? I'm not sure which. Okay. And the answer is the suspense I know you're waiting for. It's the basement. So exciting. There is actually a Club Med in the basement of this building. You may not have known that. Do we have how many answers we have yet? Our total is?
400 people who said it's in the Caribbean, 50 in the attic, and 96 in the basement.
Okay. So 96 actually got that right, so wonderful. We appreciate your participation. Still plenty of room up front. Come on down. It's great to have so many people. Well, I want to start just a little bit of the overview of what our agenda is today. We want to talk about how are we measuring our success, assessing some of the internal and external challenges that we have, and then very excited about what are we doing to look forward. We hope to be able to have enough content to share with you to give you a brief overview, but also have some time for questions. So make sure you're submitting those and thinking about the things that are important. I also am very pleased that we have, over this last year, and this is a bit of review from the last year that I have been here, we've also added a number of great new executives to our team. Hopefully you've had the opportunity to meet some of these individuals. We have Quinn McKenna, who's our Chief Operating Officer. Actually, Quinn's here with us. I'll have him stand up.
I just want to wave.
We also have Linda Hoff, who's seated next to him. Linda is also here. She is our new Chief Financial Officer. Quinn's our new Chief Operating Officer. We have David Jones, and some of these folks may be online as well. David Jones is our new Chief Human Resources Officer. Oh, David, you're right there. Perfect. I didn't see you. I did notice Dale Beatty is in the back, so please stand up, Dale, who's our new Chief Nursing Officer. And then is Eric somewhere in the room today? I don't want to miss like I did David. Eric Goblanca is our new Chief Information Officer and has joined us the most recently. So great to see those. Both Dale and Eric are from Chicago. I don't know why they'd want to move to the peninsula here. Why that from Chicago? David's locally was with Kaiser. And Quinn and I had the opportunity to work together for many years at the University of Utah, and Linda's with Legacy Health System. So great to have all of our new team here with us. Yeah, thank you. Just a couple updates. I wanted to just share with you great successes this last year, and you've seen this. In fact, we've given out, hopefully some of you have the lanyard holders. I see those as well. The U.S. News, certainly being in the top 10, number 9 is fantastic. Top 10 is really where you want to be. I don't know what UCSF keeps talking about in their ads, so there's a little variation there, but when you say you're number 1 in California, well, it's pretty close. So anyway, we always think we're number 1 here, so great success there. Obviously, this is extremely something to be proud of. And to have a magnet survey with no recommendations is just absolutely amazing. So congrats to our whole team there and all the work that went into that. At the same time, obviously, most wired, this has nothing to do with coffee intake. This is all about our computers. We're the 8th year in the row, most wired. Obviously, a tremendous accomplishment for all of the IT folks and all of the systems that we have. And then I know that you are constantly on indeedblog.com, correct? That's something that you frequent often. Well, 15 million people actually across the country have submitted surveys to this. And actually, Stanford Healthcare is number 10 in the country and best places to work among this survey, which we were very proud of. So a lot of great success there. Now we'll all be going to indeedblog.com, I have no doubt. So a lot of great information there. So also, one of the surveys that we also are part of is our UHC, or Vizient Quality and Accountability Quality Study. So I'd like to ask, where are we sitting in that? So we're number 9, we're number 25, or we're number 71? Okay, everybody submit their polling question. We'll give a few minutes for that. Okay, I'm going to hold you in suspense if you've all voted, because I'll have her give you the results in just a minute as we think about that. I also want to talk to you about, as we think about as an organization, what do we value, or what are we measuring our success by? How many of you have seen our value equation yet, or heard about that? We're very excited because one of the things that we are thinking about as an organization are what are the things that are important to us. We heard a lot in the market about value. Certainly under the ACA amendment, there was the value perspective. Payers are talking about value. As we think within our own organization, what is important to us and what do we as an organization value? This is something that we have looked at and said, these are the things that are important to us. Certainly we look at quality. That's something that we espouse, things that people come to Stanford and come to expect that measures the quality of our care. We have not only what we look at U.S. News, which does very well. We have the UHC study, which do we have the results yet?
We do.
Okay, would you read?
They're still trickling in a little bit.
Okay.
But so far we've had 266 folks tell us we are number 9, 182 with 25th, and 199 at 71st.
Okay, so about split. Would you be surprised when I told you that we were 71st in that poll out of 102? So you look at the amazing things that we're doing, but do we have opportunities for improvement? Absolutely. So part of what we've looked at in that quality equation are looking at the things that we see that really make a difference. And I have to tell you, there's a number of different areas that we have impacted, even in the short period of time, that study has come out on our mortality. A lot of great efforts when we look at the different things that are making a difference in our skip measures, the infection rates we have. And so we continue to see quality as one of those core parts of value. What does the S stand for? Service. Are we pretty good at that? We are really good at that. If you look at what CI Care has done in our organization, I was going to say, Alpa, you better be jumping up and down on it. Yes. Okay, who was at our last CI Care rounds when we actually came in? Oh, I had not worn a football jersey before. I was very excited about that. So, As I go out and have the opportunity to talk to people in our market, it's amazing how many opportunities I have folks come up and tell me how amazing the care was that they had. And it wasn't necessarily the things where they can talk about the quality measures. They talk about how they were treated, how they were respected, how their families were treated. And that makes a difference when you think about what creates loyalty for folks that are coming here, not only for the great quality of care, but also the way that they're treated. We certainly know that cost is part of that equation, and I'll talk a little bit more about that. The fortunate part is we here at Stanford are extremely affordable. In fact, we're one of the low-cost providers in this area. No? Yeah, we may want to vote on that. I don't think we want to vote on that. No, we don't. And so we do have some opportunities there, and I'll talk a little bit about that. And certainly when you look at the element that brings all of this together, what does the E stand for? That's all of us. That's us as employees. And thinking about what do, we are in healthcare a service industry. What we do is driven by us as individuals on a day-to-day basis, and that's the important aspect if you think about what can we deliver and what can we do. So this becomes what our value equation is. You'll also see this more often, and I'll actually start this. This is the slide that I show at the board meetings and the monthly managers meetings to say how are we doing as an organization on those components that are key to what value is for us. And you can see where we sit on the various scorecards on the different areas, and we'll continue to show that as part of how we're looking at our progress. I feel that it's important to know where you're at on the track. Where are you headed? Now, the numbers are not the core of everything that we do, but it certainly tells us whether we're making progress in some of the things that we value as an organization and that we want to be working on. At the same time, do we have a few challenges in front of us occasionally? We do. We certainly know that we're in a competitive environment. We know that the market, when you look at the ACA amendments, when you're looking at what payers are doing, when you're looking at what employers are doing, what onus is also being put on consumers as part of their health care. There's a number of things that we look at. So, back to opinion poll. What do you think our greatest challenge is from the components that are up there? Now, when you're taking tests, you'll know that this is one of those quiz questions there's kind of no right answer to. But we do want to know, what do you think? Because we certainly have a couple of thoughts. So, okay, I'm going to move forward and we'll get the results here in a minute. So where are we at today? What are some of the things that we're looking for? And one of the things I'm excited that Lloyd is going to talk about next is a process where we have, literally across Stanford Medicine, we are doing integrated strategic planning. But let me tee up a couple of the things that we're working on, even in preemptive to that strategic plan. We know in our market that one of the things that patients certainly look to us, we are a quaternary tertiary medical center. We have the very sick patients that seek care here at the main hospital, and they're having access to us throughout the peninsula and the Bay Area, quite frankly, and all the sites that we're able to create. But we know that that specialty center access is an important aspect to that. We've certainly done a lot of work down in the South Bay Cancer Center. We're very excited about our new Emeryville Center. We have our Redwood City Clinic that actually we've gotten some additional space there to be able to build that out even further, to make sure that we're providing those specialty pieces to the market that become so important to who we are. At the same time, we've got a lot of relationships, and most recently, actually just started a relationship with Google last week, where we provide basically the administration of their product on their self-insurance. But it allows patients access to Stanford care in a very meaningful way. And I see John Jackson at the back. Do we finally have everything signed? Okay, we're close. Can everybody keep a secret? Given we've already had about 4,000 signed up already, it's cat's out of the bag. So very excited about that. But as you can see, the other companies that we're working here, and one of the things that companies value is that affiliation with Stanford, being part of Stanford Medicine and Stanford Healthcare, because they know that's the quality within the market. And so that becomes an important venue. We also have on-site clinics that also provide a level of service to these patients in different ways. And certainly part of our strategy looking forward. UHA has been an important part of that component and has positioned us differently in markets before where we were probably not that competitive with. And it allows us access to patients. And so we have a number of sites across the East Bay area and even in the South Bay. And so there's a lot of great things that we're doing there. We continue to see, and part of our strategy is creating those alliances with others, organizations that actually refer patients to us. We are not going to be on a strategy of going out and acquiring hospitals. We were obviously very excited about the relationship that we have with Valley Care, and that's an important component of ours. But we don't see as a strategy for our organization going out and acquiring a lot of ambulatory hospitals within the market, because that's not core to what our mission is. And so you'll see that we'll continue the strategic alliances as a way of those individuals that are already sending us patients. And then certainly the last piece is the cost structure, which, as you all may have alluded to already, there may be an opportunity for us to work on occasionally for that. I do want to say that I really appreciate the great work that has been done this last year. I know that we got a little bit in a downward trend on our financials, and this team and organization responded to that very well. And when we look at where we're at today and some of the things that we have, we're in a much better position. Okay, so polling results. Actually, this is kind of interesting. So our number one, you guys are really good, by the way. The number one issue that we're dealing with now, which I'm just talking about right now, cost. So 57%. The second was employee engagement at 10%. Patient satisfaction at 9%. Sorry, I should have jumped up. Access at 17%, so that was second. So cost, access, employee engagement, satisfaction, and competition. We don't have to worry about competition, so that's good. Kidding. Okay. But a lot of great things, and certainly you see the structure where we're headed and some of the things that we value and are working on. At the same time, as I talked about even competition and even some of the challenges that we're looking at, some of the things that we are responding to, because if you look at, there are larger systems that are forming in the area. Certainly, you know, Kaiser is very aggressive on what they're doing and building. We know that Sutter is one of those organizations that continues to be part of a larger system and building that. We also see that some of the networks, quite frankly, are shifting the cost to consumers. And we know that when consumers make choices, when especially they're seeing more of that burden on themselves, that then reflects sometimes where they can go for insurance. We have seen an insurance company or two that have actually created some challenges for making access to Stanford affordable. So we've got to continue to look at where do we sit as a price point within the market, also making sure that we have the great relationships with payers, realizing the value that we do offer. But it is at a bit more premium because of the access to what they have in terms of the services here. And so that's certainly some, when we think of cost structure, it will create barriers if we're not able to address some of those issues. I love this graphic because you think about all that's been going on in the market lately with repeals to the AC Amendment. How many chances or how many times have they tried to appeal the AC Amendment just in the last year? We know of 3 significant attempts. I have to tell you one because if you look at the last Graham-Cassidy bill, would have taken $275 million out of Medicaid. Out of that $275 million nationwide that would have been taken out of Medicaid, $95 million of that would have been just out of California. So obviously we lined up against that. We see that there really isn't, when you see this graphic, you say that it was repeal and it was supposed to be replaced. It's been right now just repeal. So we continue to be challenged by this. We hope that, now with tax reform and other things on the plate, that there'll be less attention to that. Not that necessarily tax reform might be good, but we do see that there may be a stay on this. But we still stay very vigilant in looking at some of these pieces. So looking ahead, I want to give you one component, and then I'm going to turn the time over to Dean Miner. We are very excited. In fact, Bert is sitting on the front row here, and that is doing our construction management on our fantastic new center. If we could just get it open quicker, we'd be really excited. No pressure, Bert. So we continue, and you will see coming up as we get closer to the event, we will have a number of opportunities for you to be able to go in and see the building, experience what will be in this, because we remain extremely excited about some of the great opportunities that this allows us to be able to have more access in our own community. Okay, with that, let me turn the time over to Lloyd.
Great. Thank you. Well, thanks a lot, David, and I want to join David in thanking all of you for being here today. And last month in this room, we had a town hall meeting with David, Chris, Dawes, and myself, really to talk about where we are today in Stanford Medicine. Stanford Medicine being the two hospitals and the School of Medicine. And we were all very excited in that town hall to share this amazing opportunity. You know, I think in my 5 years at Stanford, and from what I know about before I arrived, never before have we worked together as well as we do now, we being the three entities of Stanford Medicine. Many of you have been here much longer and can relay your own stories about some challenges in those relationships in the past. But now we really do have a very cohesive approach, and I think that not only extends or involves the three of us, David, Chris, and me, but also increasingly is involving many, many more of you and your counterparts at other entities, both your counterparts at the Children's Hospital and also in the School of Medicine. And so now we're able really to do some serious strategic planning and really look at where we are today, where we want to be in the future. And by we, that includes all of you. That's all of us together, really looking at where we are today, where our opportunities are for the future, and how we're going to get there, how we're going to make sure that we achieve the full potential that I think we all collectively feel like we have. And I'd like to give you just a very brief overview of that process before we open it up for your questions and your feedback. So, of course, we have three entities. We have three mission elements. I think one of the points of this slide, and we didn't complicate it with a bunch of lines drawing back and forth, is that each of the three entities, the adult hospital and the adult network, namely Stanford Healthcare, Lucille Packard Children's Hospital, and Stanford Children's Health, and the School of Medicine, all three entities share the same three mission elements. We're all about patient care, research, and teaching. So although we have separate organizations, in a sense, we're all part of Stanford University, we all have, in the end, alignment on our mission, our values. And that came out, as I'll mention to you in a moment, in a survey that we did at the onset of this strategic planning process. So we did put together earlier this year several different working groups to look at what our strategic plan would be. And one of the features of these working groups is that every single one of them involves leaders from each of the three entities. There was no sort of School of Medicine working group and SHC working group. There were all three entities really coming together in these groups. And you can see that represented there in the people, and I won't go through every name, nor will I ask you to name every picture, but you can see a lot of people you recognize from Stanford Healthcare, from the School of Medicine, and from Stanford Children's Health. And we also did a survey. Many of you participated in that survey to talk so that we could get your feedback on your thoughts of where we sit today with regard to Stanford Medicine, where our opportunities are, and your thoughts about planning our future. And what we learned from that survey is that we have remarkable, not surprising, but a remarkable alignment around our mission and our vision. It may get expressed in slightly different words, and that's fine, but at the heart and core, there's remarkable alignment about what we hope to achieve, what our mission is, why we're here. And David's done a wonderful job today summarizing that about what we are as an academic medical center within a research university. But where we found we needed more focus and what guided us in putting together the working groups, is that we needed more focus and clarity on our priorities, on our goals and metrics. So how do we measure our success? How do we hold ourselves accountable for our success and for our outcomes? And that we also needed more focus around our strategic initiatives. There are so many things we could do and so many great ideas out there. How do we prioritize those ideas? How do we decide what our major strategic initiatives are? And that's really been the focus of the working groups, the focus of this stage of the strategic planning process. And then, of course, when this stage is finished, and we'll go through the timeline in a minute, then comes the work of deciding the tactics. How do we make these ideas, these strategic priorities, these goals, and the metrics associated with those goals, how do we execute on those to make sure we're really doing what we say we want to do? Well, let me give you a few examples from, I'm not going to go through every working group, but we chose 3 here, and some of the questions that they're exploring. And pictured here are the leaders of each of these 3 groups. So we have a safety, quality, and value group. This is actually a group that's been convened now for 3 years. It's a group that I put together 3 years ago because as a member of both the Stanford Healthcare Board and the Lucile Packard Children's Hospital Board of Directors, I participate in the Quality and Service Committee of each of those 2 organizations. And up until very recently, I was the only person that was participating in the SHC Quality and Service Committee and the Lucile Packard Children's Hospital Quality and Service Committee. And I would hear these great ideas in one, but then how were they transmitted back to the other? And then how did we close the loop on all of this and really bring our faculty, our residents, our fellows, our students into the process? So we put together 3 years ago this Safety, Quality, and Value Committee that brings together quality-related leaders from our 2 healthcare organizations, SHC and Packard, as well as the school. And now this committee is continuing through the strategic planning process. It's co-chaired by Denny Lund, the Chief Medical Officer at Packard, and by Norm Risk, the Chief Medical Officer at Stanford Healthcare. And one of the questions they're addressing is, and we've already heard it mentioned today, how can we balance the cost of an academic medical center, particularly the cost of an academic medical center in Northern California, with the value equation that David showed us earlier? And then a second group we formed is on the care delivery models. And it's co-chaired by Bob Harrington, Chair of the Department of Medicine, Quinn McKenna, Chief Operating Officer at SHC, and also Kim Roberts, who is the Chief Strategy Officer for Lucile Packard Children's Hospital. And one of the questions they're addressing is, what will our services across the care continuum look like at 2025? Where do we need to be? What communities do we need to be in? What services do we offer in those communities? And by bringing together leadership from SHC and Packard, how can we plan together facilities and areas of outreach so that when it makes sense, we can leverage economies of scale and efficiencies that come from planning and executing together rather than executing or planning completely independently. And then a third group, the People, Culture, and Community group, is co-chaired by Brian Bowman, David Jones, and Laura Roberts. Brian being the Chief Medical Officer for UHA, David Jones, the Vice President for Human Resources at SHC, and Laura Roberts, our Chair of Psychiatry. And one of their questions is, how do we cultivate an inclusive, respectful culture that will propel us to lead the biomedical revolution? You know, I think our greatest strength in Stanford Medicine is all of you. It's all of the people that make up this great organization. And making sure, and as David was saying, one of the things that we as leaders are most proud of is that overall we have high employee satisfaction. We have high job approval ratings by those who we have the privilege of working with. But we also know that we need to constantly focus on that. And also given the amount of strife and division that exists in our country today, how do we make sure that we in our environment are doing everything we can to build a diverse and inclusive environment, and that we live up to those expectations in our actions every day? And then finally, just to finish up, there are some emerging themes from these working groups that have been working very hard the past several months. In safety, quality, and value, there's the identification of areas of improvement, which are in mortality, care variation, and cost. And our goal is to be ranked within the top 10 of AMCs for safety, quality, and value by 2025. So something very tangible. And as David said, in the area of mortality on the Vizient rankings, we have a long way to go. But we also know that if we set our mind to it, there's nothing that we can't accomplish. And then on the care delivery models group, we're looking at intensified competition and new entrants into our healthcare delivery space in Northern California. And what we're hearing and what we need to be planning for is that the payers, employers, and the government are wanting for us to prove our value. In other words, we know that we're going to always be a high-cost system, at least compared to certain other parts of the country, and our labor costs drive much of that. And we know that, and we want to be able to attract and retain the very best people. But with that comes the expectation that we're delivering the very best outcomes. So how do we identify, measure those outcomes, and then make sure we're achieving the very best outcomes we can? And then finally, the People, Culture, and Community Committee, looking at cross-functional collaboration, how we demonstrate our value of people who work with us, and holding ourselves accountable for our performance. We want to always have patient-centered care, and we want to integrate the research and education mission with that patient-centered care. And finally, we want to, and very importantly, we want to embrace diversity and inclusion in everything that we do. So here's where we are on the timeline. I mentioned before the diagnostics we did, the survey that many of you took online. Then we developed, and also as a part of that survey, we interviewed over 100 different people. Many of you, I know, were in this room, were interviewed. We then developed this strategic plan and these the areas of focus for the strategic plan and formed the working groups that you saw. We're now in those working groups exploring the areas of focus that will be a part of the strategic plan. And then in January through April of next year, we'll finalize the plan. We'll have more meetings like this to discuss the plan. And then working up towards in June, we'll also involve, of course, our 2 hospital boards in discussion of the plan. And then in June, we present the plan to the Stanford University Board of Trustees. So if you have any feedback, there's an email address you can send to us that is about the strategic planning process, and you can learn more about it through the website that is printed there. So I think now we plan to open it up for your questions.
We do, yes.
David? Let's see. I guess we're done with slides. So.
Yeah, let me go forward one more. Okay. So we've given you a lot of material on some of the things going on in the organization. I also wanted to share, I loved one of the comments Lloyd made. This is an incredible place to work. We actually had last week our employee recognition event. We had over 650 individuals that we recognized, many of which had, I have to say, when you have 45 years of service, I'm impressed. I told them, I said, I won't catch up to you. I said, as much as I try, I can't. It really is neat to see the kind of longevity that we have. But it also is, I think, reminiscent of what I think this organization is and what it values and why people stay here. So great perspective there. So we'd love to turn the time over to question. We have microphone and then even online questions.
So before we get started, David, I just want to take a moment. Alan has shared with me that there are 1,300 online participants in our meeting today, and in addition to all of you in the room.
Great.
They're at Valley Care, they're at Page Mill, Newark, Stanford Blood Center, Tech Center, Emeryville, Redwood City, and 900 Welch Road. I think this may be our biggest town hall ever.
I think you're right.
So
amazing.
How
Fantastic.
exciting. So we do want to take some questions from anyone in the room. Please go ahead and raise your hand, and then Alan will also help us take questions from people who have submitted online. So anyone want to get us started? Okay, so Dean Miner, I heard you mention that one of the factors that contributes to our costs is obviously labor costs in the Bay Area relative to other parts of the country. But I wonder if both of you could comment on what are other factors that make us a high-cost provider?
Do you want to start, or?
Sure. I can just mention a few. I think, we have one of the highest case mix indices in the country. That is the measurement of acuity, how sick our patients are. And we're treating the sickest of the sick, and we just have to walk through the halls of the hospital, which I do frequently, as David does as well. And I've established this little mental exercise that I have walking around the hospital, and that is I count the IVACs that people are, or either they're pushing or that someone's pushing for them. The average that I have so far, any guesses about what the average is of number of IVACs in our patients that are walking around the halls? So these are people that are ambulatory. Well, the average in my informal, non-scientific survey is 4. By the way, I've seen up to 9. So we're treating, and isn't it wonderful that we're offering those opportunities, and that in many cases we're achieving such profound results? Last week, David and I recognized our bone marrow transplant team that just celebrated its 30th anniversary of the first bone marrow transplant done at Stanford. Over 7,000 that they've done in the interval. And they have one of the, if not the highest, the best outcomes in the world. And we should all be incredibly proud of that. But that's intense care, right? And it takes a lot of resources to provide that care. So I would just mention CMI as one factor. David?
Well, and just to build on that, in fact, I think I saw Tricia in here, who was our Gondo Award winner. Tricia's going to get tired of me pointing her out. She was at our BMT reunion last week. We did 455 bone marrow transplants last year, the highest we've ever done, and about 25% more than we've ever done. And so when you think about what Lloyd said on the complexity, our CMI index, however, when you look at the variation across what we treat, that sometimes leads to. So we can actually look at, and I saw Johan earlier, we actually have a tool that allows us to assess not only the complexity, but also the amount of care that it takes to treat certain diseases. And so part of what we're looking at, and part of what leads to that cost, is some of the variance in the way that we do that. And we have some real opportunity to influence that without influencing the quality. Well, we hope the quality goes up, quite frankly, and we've shown that as you can lower the cost, actually the quality goes up as well because you reduce that variation. So there's a lot of opportunity. I know our wages are high, but actually if you look at these cost studies, we wage adjust for the area as well as part of that. So it really is about the care that we're providing and making sure that we're most efficient in doing that.
Okay, I think Alan has an online question for us.
Well, I'm Gary, but this is Alan. Here's our question that came in online. Are we going to consolidate to one brand?
Great question. This is when you pause, I think if you hear what Lloyd said and what Chris and I have been talking about, what is our brand? What is it that is most recognizable? It's Stanford. So if you think about where we come together around, we really are, what is the preeminence that we as an organization can add to the overall brand? And so as we think about how do we position all of our logos, we know that the lead brand on that is Stanford. So whatever comes after that, certainly I'm sure will be the topic of discussion of our integrated strategic planning piece. But we know that the preeminence of what we have is really around our Stanford brand, and that's really what we'll build on.
How about questions in the room? Anyone?
First of all, thank you, David and Lloyd, for doing this for us. My question is about our influence over payers. How do we fit in that equation, and do you see our ability to influence payers increasing or decreasing as things change?
I think certainly we are taking a very proactive strategy. In fact, Linda and Tip and I were actually up meeting with one of our major payers, their CEO, last week, in an attempt to say, this is the power of what the brand is. Our payers recognize the preeminence of this brand. They also recognize what we offer to the market, to our patients, that they can't sometimes get elsewhere. And so we're a very important strategy. However, we have to also be cognizant that our payers are also now talking about affordability because they're being competitive with their own consumers that are buying their health plan. And so not only have we got to do proactive work with them, but we've also got to show proactively internally that we're doing those things that they're sensitive to, and that's the cost. And so by looking at the network that we're building, certainly if you look at UHA and Valley Care, that provides us a lower cost opportunity to get Stanford access quality. And certainly what we can do at our own organization also provides that. But I can tell you, we create a lot of loyalty within our brand that I think the payers find very important, and they continue to partner with us as a result of that. This can't be that quiet of a group, I tell you. Yes, please.
Hold on, let me bring the microphone over here so we can all
hear. Hey, David, just a quick question. Do we have any plans in terms of involve physician more into the quality improvement project for a specific quality indicator, or are we going to implement a physician scorecard just so everybody's on the same page to move forward?
A lot of great progress at that. Maybe I'll have Lloyd.
Sure. We did, of course, we post our patient ratings of our faculty physicians. Those are posted online along with comments. And we actually got the idea to do that from the University of Utah while David was still at Utah. And fortunately, we had mostly implemented it before he came here, so he didn't have to reinvent that wheel when he arrived. But I think that's an important step. It's one of only what need to be many more steps. And I do think that you bring up a very important point. So when I arrived here in 2012 and was going through my orientation, joining the medical staff at Stanford Healthcare, and I asked, well, can you give me a list of the formulary, that I can prescribe as an attending physician, and the drugs that are on the formulary that require, consultation or specialty approval. And I was told, well, there aren't any in the latter category. You can prescribe anything, that the hospital has, and if you want to prescribe something a hospital doesn't have, well, let us know, and we'll make every attempt to get it. And what that led to was we had some, shall we say, rather bizarre patterns of antibiotic usage. We also had usage of medications that, for which there was a lot of evidence, were not efficacious. They weren't necessarily harmful, but there was clear evidence that they weren't effective. And we were in January, but only January of this year, able to implement a formulary which very closely resembles the formulary of the VA system. That's one step. It's a constant dialogue that we have, David and I have, with our physician leaders, and one that we very much want to continue to have the dialogue, because in the end, each of us, and certainly as a physician, I include myself in this, each of us needs to be accountable for what we do in our work activities. I think that our patients expect it of us, society expects it of us. And so moving more towards transparency and accountability is going to be a continued theme moving forward.
Just to build, yeah.
Do you want to talk about the aligned share incentives around quality?
You bet.
Sure.
Why don't you share that?
So in answering that question, how do we align with the physicians as well? We've actually taken some of the funds flow dollars that have already been transferred between the hospitals and the School of Medicine departments and taken a portion of that and tied it to performance around quality. So actually the clinical chairs are aligned, and now they need to align their divisions and departments.
One thing, sorry, just to build on a little bit with what Lloyd said, one of the things that I get very excited about is one of the measures that certainly we look at, and I know that you ask the question before you go to any healthcare visit, what their mortality rate is, right? No? That's an important score to know. Well, One of the things that Lloyd and I have been working on with the chairs, quite frankly, is we have some opportunity in our mortality scores. We have a tremendous draw to a lot of people in our region and a lot of the areas where sometimes there's no other choices that are appropriate for them. And one of the things that was recently implemented is if a patient is in a facility inpatient more than 2 weeks, there's probably not a lot that we can do in transferring them. So the chairs have been working very closely to say, how does our mortality scores, when you look at some of the overall rankings that we look at, our mortality scores are a little high. Well, the reality is we end up taking a lot of very sick patients, and we need to weigh all of that in. And the chairs have been extremely helpful in saying, how do we make sure that we get the patients in, that we can really impact their care and do those things that will help their outcomes as well. This organization responds incredibly well. I mean, we have an incredible intellectual horsepower here, and we look at some of the things that we're challenged with, and we're able to respond very quickly. But certainly, great question in terms of some of the measures.
We do have a couple questions. We have a couple questions online. Here's one. My question is around growth for SHC. What is the current state for primary care clinics and employer-based clinics inside the Bay Area or outside?
Well, we could continue to look at opportunity there. I mean, one of the challenges that we have, if you think about the quaternary tertiary aspect of what we do, it would be incredibly difficult for us to be able to build a primary care base large enough to be able to support that. So we continue to rely on what are those relationships that we have with referring hospitals that send those patients here. They're an important aspect of our academic and teaching mission. We have built some fairly large size, not only in our primary care base, but we'll never be able to grow that big enough. But we will certainly grow as we look at these partnerships that we create with employers, because that becomes an immediate front line in terms of those individual groups. And we always are looking at opportunities that help us fit with that mission of what we're trying to accomplish with our employers and also the base with our secondary providers.
So one of the questions submitted previously has to do with how do we take things off the list? You know, we're Stanford. We keep coming up with great new ideas and great new initiatives and things that we would think we could do, but sometimes there's a sense that we're taking it all on, maybe all at the same time. So how do we shift gears on that?
I'm going to definitely let the dean go for it. No, I'm kidding. Let me start. I know Lloyd and I have a lot of thoughts on this. We are 1,000 flowers blooming at Stanford. We have incredible. I mean, if you look at the research, the science of what we're involved with, we don't want to limit any of that. I mean, quite frankly, that's what is the core of what differentiates us as Stanford, is that research and that ability to teach. However, when it comes down to what can we all do in the clinical environment, we do have to create a focus. So at the end of the day, we can't be everything to everybody. We try to do a lot of great things. And if you look at some of the programs that we've become preeminent in, those certainly will come out of the integrated strategic plan, that we need to focus more in those. But we do need to create a focus. We can't, at the end of the day, be all things to all people. And it allows us to be able to do some of the things in a clinical environment that really continue to differentiate us.
Very well stated. And I think the strategic planning process is one way that we start, well, we've already started, but we continue the process of identifying priorities. The other way that we do it is by where we invest resources. So that those two need to link up, identifying strategic priorities and then deciding where we focus our resources and making sure those priorities are actually carried through on. We never want to close the door, though, particularly at the level of an outstanding faculty member who brings a lot of skill and expertise in research or patient care. We never want to close the door on that person being able to build her or his vision. But there are going to be a limited number of places where we can invest institutional resources. But really innovative people who are hardworking are able to garner their own resources and help to make things work themselves. And we never want to shut that down, because a lot of great things come out of organizations that have great people, some structure to the planning process, but also enough latitude for every individual in the process to be able to chart her or his course. And in situations where it's needed to make their own reign in terms of resources and opportunities.
Well, we maybe have time for one more question.
We do, and before we take our last couple of questions, I just want to remind everyone about your raffle tickets. Gary tells me you do have to be present to win for the people in the room. However, for those of you who are online, there is also an opportunity to be part of the raffle. And we also have some really nice refreshments outside, so please enjoy that when we're done. I think we have a question on the other side of the room.
Yeah,
yes,
please.
we've had a lot of growth and then some financial challenges recently. Where is our focus now? Are we going to look at employer-based businesses as our future growth opportunities, or will we also look at maybe acquisitions of other smaller institutions?
I think certainly as we look at what we do, I mean, we really, quite frankly, a lot of the base of our patients that come in are coming in from the regions. They're coming in from the more difficult cases that can't be treated elsewhere into, quite frankly, preeminent programs. We'll continue with the smaller-based employers, but that becomes a very small piece overall of what we do. So the relationships with the Googles and the Intels and others that we hope to precipitate create a nice network for us to be able to, quite frankly, do the primary care, be able to do some of the pieces that we think we provide on the value piece, and even having those on-site clinics. But I think that will continue to be kind of a small portion of the overall care. It really is, how do we attract the more acute things that really add back to the research and academic mission? We aren't necessarily, as I was alluding to earlier, we aren't in the mode of saying we want to go out and acquire other hospitals or facilities, because that just isn't the base of the network that we want to produce. You will see us, though, continue, like I referenced with Redwood City. We have the addition to expand there. We have Emeryville. We have other sites that we'll look at that are more the larger secondary ambulatory presence that will really allow us to grow into the region. But that'll be more the focus than looking at building our network of hospitals in the area. Thoughtful question, though. Thank you.
Okay, so maybe one last question for the two of you, which is, what keeps you up at night?
Yeah, I think, well, for me, it's really making sure that we collectively are fulfilling the opportunities and I think the commitments and promise that we have as an organization. I feel very privileged, particularly privileged to work with David and with Chris on a daily basis. I think there's this energy and enthusiasm in Stanford Medicine today that really, really is remarkable. But with that, and with the fact that we are Stanford, comes enormous responsibility on our shoulders to make sure that we're living up to the expectations that we should have for ourselves and that others have for us. And so I would say, if anything that I worry about at night is that, have I, as a leader, done everything that I can to make sure that we're achieving our success, and in collaboration with David and Chris, make sure collectively that we've done everything we can do.
And just to add to that, I think one of the things that I came for, and about a year ago, a little over that, is because of that great relationship with the leadership here, both with Lloyd and Chris, that ability, and with our own team. Now, what keeps me up at night? Quite frankly, when we do really well. You're going, okay, that's counterintuitive. Why would you be saying when you do really well? Because I think somebody else is catching up to us if we're doing too well. Because somebody else is going to create something around us. And are we really, and I've used this quote many, many times, Jim Collins, Good to Great book, the moment you think you're great, your slide toward mediocrity has begun. And so how do we make sure that we're always staying ahead or staying abreast? Because there are others in the market around us. And so I want to make sure that we're always doing those things that position us to be in the best position in the market and, quite frankly, take advantage of what Stanford Medicine is.
Thank you, David. Thank you, Lloyd. And now I think Gary has some raffle tickets for us.
Okay, here are, can everybody hear me? Here's a Starbucks gift card for all our coffee drinkers, 7752-551. Come on up here if you want.
All right.
775-2378. You are a winner. Come on up. 775-2381. You guys are all drinking coffee. Whoops. Okay. Next prizes are Amazon. Amazon gift card, 775-2563. Come on up. Claim your prize, 775-2537. Amazon gift cards, and the grand prize, Whole Foods. Lots and lots of Whole Foods. 775-2492. Thank you all very much. Thank you to our guests. Thank you, everybody.